Assalamualaikum and good afternoon to Miss Nabila. I am Muhammad Rafai Bakri from SEM 5. We're going to present about our first aid assignment, which is role of safety and health practitioner in implementation of first aid at the workplace. So the first one, I'm going to talk about first aid. First aid is a provision initial, immediate and on-the-spot treatment to the victim of an accident or sudden illness. It is usually performed by a non-expert or expert, which is the first aider, person to a sick or injured person, until to take care of medical treatment for medical personnel. Every individual should train with potential life-saving techniques and to perform with minimal equipment because in Malaysia, increasing number of accidental emergencies in the society increase the need for first aid management and preventive service. This service help to reduce the mortality, morbidity, disability, and impairments caused due to road traffic accidents such as head injury, fracture, spinal leg fracture, hip fracture, chemical and electric burns, and etc. Which is it's not focusing on the traffic accident or what. In safety and health, we focus it into safety and health. The term safety and first aid measure on selected emergency condition usually refers to the people who are managing emergency situation at time. The most emergency situation occur from so many reasons. Many persons get injury and die occur due to unintentional and suddenly happen in emergency condition. Safety and first aid training are more popular, are well equipped in a first aid skill arranged by student and staff because any emergency that occur can be handled. Emergency service providing caretaker for managing the accident. The trained staff and student of the first aid are essential for risk assessment. In organize of a program of or courses of student about deliver the knowledge and first aid as benefit help in school as well as community people, which is if we adapt it since school and more further to the workplace or what, it will be more better for reduce the accident. And the second one is legislation. The first act is the FMA, which is Factory and Machinery 1967, which is at the section 25 of FMA and regulation 38 of the FMA. Regulation 1970 state that scope responsibility of occupier with regards to first aid provision. The scope includes providing and maintaining a first aid box and cupboard of such as may be prescribed and ensuring the box is readily accessible at all time. Assigning at the responsibility to upkeep a first aid box of cupboard to a responsibility person, and for a factory with more than 20% employed, specifying that the responsible person should be proficient in the first aid treatment and providing and maintaining a first aid room in a factory person are employed. The second act regulation is OSHA 1994, which is at section 15 of OSHA, provide that every employer and self-employed person must ensure, so far as practicable, the safety, health and welfare at the work of his employees. The provision of first aid facilities and first aiders is a compliance with the welfare component of this general duty of employers and self-employed person. Third one, I'm going to talk about first aider. First aider is someone who has undertaken training appropriate to the circumstances. They must hold a valid certificate of competence in either first aid work, emergency first aid work, and any other level of training or qualification that appropriate to the circumstances. Certificates for purpose of first aid at work lasts for 3 years before the certificate expired. First aider will need to undertake a requalification courses as appropriate to obtain another 3 year certificate. On certificate have expired, the first aider is no longer considered to be competent to act as a workplace for first aider. The Health and Safety First Aid Regulation 1981 required employers to provide adequate and appropriate first aid equipment, facilities, and people to enable your employees to give an immediate help if they are injured or taken ill at work. The selection for first aider, an employer shall from time to time recruit or select suitable person to go for first aid training. The employer should consider person with the following qualities to be trained in first aid: physical fit, free from blood-borne infectious disease, for example hepatitis, HIV, and free to leave their work immediately to respond to an emergency. The first aider training is recognized courses on first aid conducted by institution are recognized by DOSH as meeting the first aid training requirement. The need or refresher training first aider need to undergo a recognized courses on every 3 years. Training record: the employer should keep a record on dates on which first aider obtained their training and the date on which they receive refresher training. Responsible of first aider, or what first aider do. The first one is assess to the situation quickly and calmly to get the understanding of what happened. This involves determine whether anyone is in danger, the cause of situation, and how many people are affected. The second one is comfort, reassure, stay calm, and take charge. You should introduce yourself to the casualty, explain what's happening and why, and explain what are you going to do before do it. The third one is protect yourself and casualty from any danger. You should always protect yourself first and only move the casualty if leaving them would cause more harm. If you are unable make an area safe, call an emergency help. And the fourth one is prevent infection between you and them. You should wash your hand or use hand sanitizer, wear disposable glove, or not cough, sneeze over casualty. Assess the casualty. Is there a multiple casualty? You must help those with life-threatening injuries or condition first. This sixth one, give first aid treatment, such as CPR or applying pressure to bleeding wounds. Life-threatening injuries and condition must be prioritized before giving treatment to less serious cases. And the last one is arrange for the right kind of help. Call emergency service or ambulance if it is serious, or take the casualty to a hospital if it is serious, unlikely to get any worse. For less serious condition, suggest they see a doctor if they are concerned of if condition are worsened. You should always stay with them until you can leave them in the right care. Next is first aid kit checklist. Most small accident can be dealt with within the workplace, provided that you have a well-stocked first aid box on hand. In fact, the Health and Safety First Aid Regulation requires all employers to provide adequate and appropriate first aid equipment, facilities, and qualified people so that employees can receive immediate help if they are injured or ill at work. So, the basic first aid item to include in the workplace first aid box is a leaflet giving general guidance on first aid, individually wrapped small, medium and large sterilized gauzes dressing, individual wrap, sterile, triangular bandage, safety pins, sterile eye packs, eye wash and eye bath, plaster, wipes, advice tape, disposable nitrile glove, crib roll bandage, finger dressing, research face shield, alcohol-free cleansing wipe, burn dressing, distilled water for cleaning wounds, tweezers and the scissors. And last but not least is the first aid room. First aid room should be established at the workplace if a risk assessment indicates that it would be difficult to administer appropriate first aid unless a first aid room is provided. For example, workers who carry out work at the workplace where there is higher risk of serious injury or illness occurring that would be require immediate first aid and further treatment by an emergency service may benefit from having access to a dedicated first aid room. A first aid room is recommended for a low risk workplace with 200 workers or more and high risk workplace with 100 workers or more. The item should be in the first aid room is first aid kit appropriate at the workplace, hygienic and hand cleanser and disposable paper towels, and examination coats with waterproof surface and disposal sheet, an examination lamp with magnifier, a cupboard for storage, a container with disposal lining or solid waste, a container for the safe disposal of sharp, a bowl of bucket, electric power points, a chair and table or desk, a telephone and or emergency call system, the name and contact details of first aider and emergency organization. The first aid room should be located within easy access to a sink with a hot and cold water and toilet facilities. Offer privacy via screening or the door. Be easily accessible to emergency service. Be well lit and ventilated. Have an appropriate floor area. Have an entrance that is clearly marked with the first aid signage. Maintaining the first aid room should be located to a trained occupational first aider, except where is this room is part of health center or the hospital. And for conclusion, first aid as an important tool in quickly responding to accident to ensure that injuries can be efficiently and promptly dealt with before trained medical professional arrive to administer more specialized treatment. First aid in a workplace is especially helpful as a worker often get into accident that can need a swift care in order to prevent things from escalating, whether it's a minor injury or something more serious like a fracture. Preventing further complication is paramount. Ensuring there are trained first aider within the workplace will help workplace be a safer environment for everyone. Here are just some of benefits that come from having the first aider on site. Accident will always happen. Therefore, it is essential that whenever your location is working environment, you understand the importance of first aid supplies in order to ensure maximum safety for everyone involved. Without adequate first aid equipment, a simple treatable injury could turn into something much more serious. First aid doesn't just help with recovery, it helps save life.